Hello and welcome. Today we're delving into a fascinating and potentially life-threatening neurological condition, snake venom-induced neuromuscular blockade. Join us as we explore the causes, mechanisms, symptoms, diagnosis, treatment, and future directions in understanding and managing this fascinating clinical condition. The primary cause of neuromuscular blockade from snake venom is quite simply snakebite. Certain snake species, particularly those belonging to the families Elapidae and some Viperidae, possess venom containing potent neurotoxins. These neurotoxins are the key culprits behind disrupting the communication between nerves and muscles. The severity and type of neuromuscular blockade depend on the specific snake species, the amount of venom injected, and the individual's sensitivity to the venom. Let's understand how snake venom disrupts the nerve-muscle communication. The neuromuscular junction is the point where a motor neuron meets a muscle fiber. Nerve impulses trigger the release of acetylcholine, a neurotransmitter, which then binds to acetylcholine receptors on the muscle fiber. This triggers muscle contraction. Snake venom neurotoxins typically work through one of two mechanisms. Some, called pre-synaptic neurotoxins, damage the nerve terminal, preventing the release of acetylcholine. This blocks the signal from ever reaching the muscle. Others, postsynaptic neurotoxins like alpha-bungarotoxin, bind directly to the acetylcholine receptors on the muscle fiber, preventing acetylcholine from binding and triggering muscle contraction. Either way, the result is the same: the muscle cannot receive the signal to contract, leading to paralysis. The occurrence of snake venom-induced neuromuscular blockade is closely tied to the geographic distribution of venomous snakes. It's more common in regions with a high snake population and where people have frequent contact with snakes, often in rural or agricultural settings. Southeast Asia, Sub-Saharan Africa, and South America are particularly high-risk areas. Certain occupations, such as farmers, herders, and those involved in forestry or wildlife, are at a higher risk of snakebite and subsequent neuromuscular blockade. The signs and symptoms of neuromuscular blockade can vary in severity and progression, but some common indicators should be considered. Initially, patients might experience localized pain and swelling at the bite site. However, the defining symptoms are related to muscle weakness and paralysis. This can manifest as drooping eyelids, ptosis, difficulty swallowing, dysphagia, difficulty speaking, dysarthria, and generalized muscle weakness. Critically, paralysis of the respiratory muscles can lead to respiratory failure, which is a life-threatening complication. The timing of symptom onset can vary from minutes to hours after the bite, depending on the venom potency and amount injected. Diagnosing snake venom-induced neuromuscular blockade involves a combination of clinical assessment and laboratory investigations. A history of snakebite, particularly in a region known for venomous snakes, is a critical clue. Observing the characteristic symptoms, such as ptosis, dysphagia, and respiratory distress, further supports the diagnosis. Blood tests can assess for elevated levels of muscle enzymes like creatine kinase, indicating muscle damage. In some cases, electromyography (EMG) can be used to evaluate the function of the neuromuscular junction. However, diagnosis primarily relies on clinical signs and the response to antivenom. While snake venom-induced neuromuscular blockade can be broadly categorized by the pre-synaptic or post-synaptic mechanism of action of the venom components, this classification isn't always clinically relevant for immediate management. The key consideration for clinical practice is the severity of the blockade and the presence of respiratory compromise. The cornerstone of treatment is antivenom, a specific antibody preparation designed to neutralize the venom's toxins. Antivenom should be administered as soon as possible after a confirmed or suspected venomous snakebite. The dosage and type of antivenom depend on the snake species involved and the severity of envenomation. Supportive care is crucial, particularly in cases of respiratory failure. This may involve intubation and mechanical ventilation to maintain adequate oxygenation. Other supportive measures include monitoring vital signs, managing pain, preventing secondary infections, and providing nutritional support. Cholinesterase inhibitors, such as neostigmine, can sometimes be used to improve neuromuscular transmission, especially in cases involving postsynaptic neurotoxins, but their effectiveness can vary. Preventing snakebite is the most effective way to avoid neuromuscular blockade. This includes wearing protective clothing, such as boots and long pants, in snake-prone areas. Avoiding walking in tall grass or dense vegetation is also recommended. Being cautious when lifting rocks or logs, where snakes may be hiding, is also crucial. Educating the public about snake identification and safe behavior around snakes can help reduce the risk of bites. Improving access to prompt medical care and antivenom in rural areas is also a key preventative measure. The prognosis for snake venom-induced neuromuscular blockade depends on several factors, including the severity of envenomation, the time to antivenom administration, and the availability of supportive care. With prompt and appropriate treatment, most patients can make a full recovery. However, delayed or inadequate treatment can lead to prolonged paralysis, permanent disability, or even death, particularly from respiratory failure. Recent research focuses on improving antivenom production and delivery, developing novel therapies to counteract venom toxins, and understanding the long-term effects of envenomation. Advances in point-of-care diagnostics may allow for faster identification of venomous snake bites and more targeted antivenom administration in the future. The fascinating and complex field of snake venom research continues to evolve, paving the way for better outcomes for snakebite victims worldwide.